Hello, Team 2 is happy to present Busy Bee, assisting new mothers while screening for postpartum depression. Postpartum depression is defined as persistent and severe depression after delivery that may produce psychosis or thoughts of self-harm. Risk factors include pre-existing mental health conditions, infant health concerns, and poor social support. PPD affects 10 to 20% of mothers and also impacts the health of the infant and family. A 2020 study shows that medical expenses are over 22% higher in affected households. But PPD is treatable, and with early identification comes greater success. The primary goal of our project is to reduce costs and health impacts of PPD. We believe we can achieve this through identification of mothers who are at risk for PPD through AI analysis of voice tone, Alexa interactions, crying frequency, and other ambient data, and then offering early intervention to those patients. We seek to reduce costs and the negative health impacts of PPD by increasing access to health information. We believe this can reduce the number of contacts with medical staff and provide reliable, trustworthy information instantly to patients. We also seek to assist with triage and access to telehealth and to ensure timely, meaningful medical contacts, thereby preventing downstream costs and effects. We began our research by analyzing birthing data from Duke Hospital using Slicer-Dicer in order to identify the demographic most likely to benefit and thus most likely to maximize our return on investment. We gathered attitudes and beliefs from forums and websites like Reddit and Facebook. This allowed us to formulate questions we needed to ask when designing our product, research, and marketing strategy. Here, we analyzed recent posts on NetMoms for content and saw that concerns about the mother's health were most frequent. We developed and distributed a survey using Qualtrics software. We iterated on our survey multiple times to ensure the survey was short, with 7 Likert questions and 1 free response, that the wording was intentional, and that the questions became progressively more personal. We received 34 anonymous survey responses from mothers, mostly in the RDU area, who were recruited primarily by word of mouth. We also conducted 7 in-depth interviews averaging about 30 minutes each, with moms ranging in age from 23 to 35. We also received 19 free text responses of additional input from the 34 respondents on the survey we conducted. Using Duke EHR data, we determined that the average age of birthing mothers in 2023 was 31, and the population was predominantly Caucasian. Rates of depression in mothers increased significantly during the COVID-19 epidemic. Given that information, we determined that millennial moms would provide the highest potential ROH and ROI for our project. We performed extensive additional psychometric research on this group using secondary sources. Our research showed that millennial moms are typically older, more educated, more diverse, and more likely to be single than moms in the past. This group is also famous for being the first group of digital natives who have been raised with the internet. Millennials are likely to feel that tech makes their life easier and allows them to use their time more efficiently. It also helps them to feel closer to their family. We also found that millennials are likely to use social media for support, product research, and education. They also share a lot of their lives on social media. We identified some key barriers. In order to catch PPD early, we needed to get moms to have her device in the home and turned on. We also needed them to trust the device enough to engage if the device noticed signs of PPD. In order to improve access to health information, we needed to provide reliable, trustworthy information instantly. However, respondents in our interviews reported being unlikely to trust health information provided by Alexa. We recognized that we needed to create a device that each mother found uniquely trustworthy. Our research showed that nearly half of our respondents didn't own an Alexa device. We determined that we needed to build a device that would meet mothers' needs in a way that a regular Alexa device did not, in order to encourage regular use of our solution. Most of the needs we uncovered were real stated needs. The mothers we talked to wanted a personal assistant to help with issues like coordinating a meal or cleaning service, helping with insurance paperwork, breastfeeding reminders and timers, and ordering or reordering supplies. Many moms want to use this device to track milestones and patterns so that they can communicate more precisely with doctors. Mothers also want to be able to ask simple medical questions like treatment of rashes or giving medications. Mothers across the board wanted to ensure the information they're receiving from Alexa matched their definition of credible. For some mothers, this meant mom-to-mom peer information, while for others it meant information from clinically vetted sources like the Mayo Clinic. We identified delight needs, including acute appearance, integration with social media, encouragement and positive affirmations, and entertainment with music and humor. Standard needs included ease of use and functionality. Our research also indicated a secret need to feel like a good mom. Unknown and revealed needs will have to be uncovered through analysis of actual use. We performed a detailed correlation analysis of our survey data. This revealed correlations between depression and teething, which can cause a lot of crying. We also noticed a cluster of concerns about the baby, things like bathing, feeding, and rashes. If respondents were concerned about one item, they were more likely to be concerned about other similar items as well. From the data we gathered, we noticed two distinct populations: mothers who were concerned with this cluster of baby's health needs and those who weren't. We consider mothers who are concerned with the baby needs cluster to be high involvement, while mothers that are not as our low involvement consumers. We need to tailor our marketing and offerings to each segment. Our high involvement segment wants answers to their pressing questions, so the medical suite of features will be emphasized. Based on our interviews, this segment was willing to use information if they also had the assurance that they were going to see a doctor when necessary. Moms who were concerned about their baby's needs were more likely to want to use telehealth, so we wanted to emphasize that for this group. We needed to find a way to consistently engage the moms who weren't as interested in asking medical questions. We focused on the practical and delight needs of this segment. Notably, we're hoping that the support from these practical tasks will not only help them track their health and the health of their baby more efficiently, but also assist them in communicating accurate data to their doctors if any troubling trends arise. We heard from both segments a need to trust the source of the information provided. They also sought social support, and so our solution should connect to social media. Our solution will increase self-esteem by being fine-tuned to be likable and to give positive affirmations. It will also be easy to use and can be used hands-free. As a result of our research, we developed Busy Bee, an Amazon Alexa solution to help new moms and screen for postpartum depression.
I've noticed that your baby has been crying quite a lot lately. Would you like me to arrange a babysitter so that you can catch up on sleep for a while?
Gee, thanks, Busy Bee. That would be great.
By the way, I've also noticed that your voice has been very strained and that you are changing a lot of diapers. Sometimes new mothers can feel sad when they are under stress. Could I schedule you for a telehealth visit to discuss your feelings?
You know, Busy Bee, I have been feeling sad. I could really use a telehealth visit, or at least a pina colada. Thanks.
Our research of millennial moms showed that being a good parent was the single highest priority. Interestingly, helping others in need was also a high priority. This theme was repeated in their preferences for ad content. Humor and advancing social good were tied as the most liked ad themes. Participation in Busy Bee gives all new moms a way to help others and advance societal good through contributing data and helping to improve our device. In our high involvement segment, we wanted to focus on strong logical arguments about how Busy Bee can help them to be better parents. Due to their interest in their baby's needs, our core messaging with this group is, we have all the answers to help you be a good parent. We also want to appeal to authority, like influencers who run good mom accounts. And we'll emphasize how accurate and effective our information triage and appointment system is at getting proper medical care for the baby. For our low involvement segment, we want to get our product on the mom's radars because they'll be deterred by too much information. Our main message here is you're busy and we can help. We'll use humor like influencers who run fun mom accounts and show pictures of moms relaxing and smiling. We'll also have cute videos of kids interacting with Busy Bee or asking it funny questions. In order to show that we're improving the bottom line and patient health, we'll track metrics including engagement, measured by prompts responded to per day, adoption, measured by hours the device is on and obtaining audio, effectiveness based on medical appointment availability rates, and cost based on healthcare spending. Early identification of mothers at risk for postpartum depression can decrease costs and save lives. Our solution offers support, reassurance, and convenience to millennial moms who can be divided into high and low involvement segments. Here's a list of our references. Thank you.